All right, Dr. Malone, we are here for our daily chat. I am gonna, gallery night is supposed to be happening out here. So this street is supposed to be full of people, right? And the charity this month was Gulf Coast Kids House. And we should have a bunch of people spray painting the wall here, but we don't because of the virus. So instead,
otherwise it'd be a beautiful night and the streets would be packed.
Right. And instead of that, we got a couple of stragglers here that obviously are not 6 feet apart from each other. And then we've got some other folks that don't really care about that 6 feet rule. And then we got a wall that nobody's trying to spray paint tonight. So in any event, that's not why we're here. We're here to talk about the virus and for you to give us the update from a medical perspective as to what's going on. And I was going to chat a little bit about that with you. Go ahead.
Okay. Yeah. So I guess locally, no change in any of the test result numbers. With the press conferences today, it's indicated that there's upwards of 670 tests that are pending. And they're looking at those resulting as looking at this weekend sometime like on Sunday locally. I guess my recommendation and the party line, so to speak, of any of the authorities is just act as if people around you could potentially be infected and take all precautions, because I sense that with the one diagnosed case in Escambia County, there's a chance that them having tested 670 people, and those people qualified through the screening to get tested and felt badly enough to be tested, that there's going to be some other cases that come back as positive. Doesn't mean that more people are being infected. It's just that we're, again, measuring that. And I mentioned that a couple other times this week. So I think there's probably going to be a sense of maybe concern when we see that number jump, because it's going to. And it's starting to do that in some of the other counties. So like Okaloosa is up to 7 already. So that's where we're at with the local test results. As far as the local restrictions, here we are again another day, and what was it yesterday? It was all the restaurants and establishments were going to curbside. Now it's the beach is shut down, the parks are being shut down, and any gym facilities are being shut down. And that's both on a local level as well as, I guess, state mandated at this point. So this is something that I think people need to listen to, and I would recommend that. As far as I guess, interesting tidbits that I try to look for every day to share with people. I've seen a couple of mentions where, it's beautiful weather out. You're standing outside and it's warm and it's a great day. And there's some folks out there saying, oh, well, when the weather warms up, we don't have viruses. So we're going to have that natural fix to what's going on with the viral infection here. And doing some research here, there's a couple of groups of scientists that have looked into this, and they don't anticipate that that's going to happen, that there's a seasonal fix that's coming. They do anticipate that there is some sort of a seasonal or environmental impact as far as temperature and humidity. And that's something that would be used to track forward and best be prepared in certain parts of the country as far as how to anticipate these things, because this isn't going away, meaning the virus is probably going to be here for months, if not years. Hopefully not to this degree, obviously, but it's one of those things where they can anticipate the seasonality of it and it's best for the population. So I don't think it's going to be something that it gets warmed up and it's 85 degrees and all of a sudden the virus is gone. There's a lot more elements at play besides the temperature.
Okay, so you broke up there for a little while when you were doing the. We were talking about the medications. You broke up. Can you go over that one more time, please?
As far as the medications, well, I guess to revisit what we talked about yesterday, the anti-malarial medications, I guess they backed off a little bit on that, I guess, excitement as far as it being like a fix, but it's certainly something that being pushed forward on as far as supplying the country with that, so that we could potentially explore the intervention to try and nip this thing in the bud, I guess, for lack of a better term, as far as a further spread from infected individuals. What I did mention earlier, where Professor we broke up, was the seasonality of the virus. And right. So there's folks out there that are saying, well, in the summer months, we see all these viruses go away. And I think there's some people with wishful thinking that that's going to be the case here. And the science behind it right now does not anticipate that that's going to happen. So it's not like it's going to be 85 degrees for the next week and all of a sudden the virus is gone.
All right. That doesn't sound encouraging.
Now, well, the encouraging thing is that
any progress on the malaria drug?
No progress there, other than it's not closed to use, and I guess the authorities are getting it on hand and getting it ready to go so that it can be potentially used for some of these infected individuals. They're calling it compassionate use indication, and that's what we talked about was fast track the other day. So hopefully some of these small trials can be extrapolated into some of the infected populations, and we could start to see some significant outcomes that would be worth, getting this into on a larger rollout. All right.
I also heard, sorry to interrupt, I also heard they're actually calling in people who are not actively practicing medicine. Just as tele-nursing or tele-nurse practitioning. And they had asked if she was interested in coming in to help. Have you heard anything from the Department of Health on that regard?
I personally have not. I'm on the mailing list just as far as being a licensed practitioner, and I see that in an effort to get some of these communities, I guess, prepared, there is a call for trying to best utilize some of the staff or practitioners. And it's not always, hey, put on your white coat and go running into the hospital. It's being available for, like you mentioned, the telemedicine, or for consulting, or for helping to support the best practices. So I've seen those, though I haven't personally been drafted or anything like that.
All right, very good. Well, that's a helpful information. Thanks again. We'll try to do the same thing tomorrow.
Yeah.
I'll get down to do curbside takeout, and I encourage people to come do that. Just stay 6 feet apart from each other. And same thing, I think all of them are actually.
Yep.
So they're all pretty much set up to do curbside stuff.
Yeah, and I think
patronize them as long as you observe. As long as you observe the 6 foot rule and you're paying attention to the other guidelines. I mean, I think it's great for the community to try to support these businesses that are not going to fare well, unfortunately, because of all of this. The one thing I'd want to point out is that we're still meeting with clients. I met with several clients today, brand new clients. We did it virtually. Everything is set up to meet with these people via Zoom and FaceTime and whatever else we need to do. And we've sort of mastered almost the document exchange. So we plan on staying open as long as we need to. We're not going to change our hours. We're not going to do anything different. The only thing we're going to be doing different is we're not going to make people come in and meet with us as part of the process. So if you have legal questions, you can obviously reach out to us on the web, or you can call us at 855-HIRE-JOE, as always, and we'll be back tomorrow with another update. Dr. Malone, did you have something else you wanted to say?
I was just going to say, and this is just observationally, I think tomorrow is going to be the first real weekend day where effectively we're the most shut down that we've been ever. So resist that urge to go out and do your normal Saturday type activities, whether it's running errands or, unnecessary errands, or, going out to the beach, things like that. You won't be able to do that. So try to come up with novel ways to entertain family and friends while observing some of the guidelines that you had mentioned there as far as the distancing and whatnot.
In just to be clear, so it doesn't sound so hypocritical, when I'm coming to the office, I'm pretty much by myself. There's one other person here now. We don't ever get that close to each other, and there's 10,000 square feet in this building, so we can easily separate from each other. And everybody else is working remotely from home, so When I come into the office, I'm pretty much coming in by myself. So I get out of my car by myself, and I get into the office by myself. And if maybe a member of my family could be with me, but aside from that, we're observing all the social distancing rules. So, all right, folks, stay vigilant, and we'll see you tomorrow. Thank you, Dr. Malone.
All right, take care, guys.